Primary school teacher Joana Hernandez is back in the classroom after nearly a year and a half. But today, the kids in the class are her own children. Students attend in-person classes just twice a week. As part of the push to fully reopen schools, Venezuela has started a COVID-19 vaccination campaign for kids. But as much as she'd like to go back to the classroom teaching full-time, Hernandez says getting kids vaccinated is a tough decision to make.
If they propose the Pfizer vaccine or the Chinese one for kids, I would totally agree because those have been tested in other countries and have good results. However, with other vaccines, I won't take that risk.
The Venezuelan government says it has approved Cuba's Soberana 2 COVID-19 vaccine for children aged 2 to 11, and it said it had plans to approve another Cuban vaccine and a Chinese vaccine as well. But the Venezuelan Academy of Medicine has warned against the use of the Cuban vaccines, saying they have not been verified in independent clinical trials or approved by the World Health Organization.
After seeing the clinical trials using China's Sinopharm and Sinovac vaccines in South America, we consider them the best option to begin vaccination for kids 2 years and older.
Adolescents between 12 and 17 years old have been eligible for COVID-19 vaccination since October. They're getting China's Sinopharm vaccine. Venezuela has also received doses of the Sputnik V vaccine from Russia. For the 3.5 million children in Venezuela between 2 and 11 years old, parents will need to make a decision to vaccinate or not to vaccinate. For now, vaccinating children against COVID-19 is not mandatory, and it requires parental consent. Amanda Mata is the legal guardian of her 8-year-old nephew, Ismael. She says she's going to wait for more information on the Cuban vaccines before taking Ismael to get a shot.
There is no evidence to give me peace of mind to know that he will get something that's going to help him. Otherwise, I feel he'll be used as a guinea pig.
Pediatrician Lilia Vega says it's both a matter of trust and priorities. She's a member of a Venezuelan parent network that's urging the government to make vaccines for high-risk people a higher priority than vaccines for children.
At some point, children and the whole population must be vaccinated. The thing is that in a country with extremely limited resources for vaccination like Venezuela, the priorities must be clearly defined.
The Pan American Health Organization reports about 32% of Venezuela's population is fully vaccinated. Health experts are concerned as the virus continues to mutate. Vaccinations may be more important than ever to protect both children and adults. Triny Mena, CGTN, Caracas.